Let's talk about one of the first big challenges many new parents face, helping their newborn latch. Breastfeeding is often portrayed as this effortless, natural process, but the truth? It can be tricky, especially in the beginning. If you're struggling to get your baby to latch, you're not alone. The good news is, with a little guidance, practice, and patience, it gets easier. So what exactly is latching? Latching is when your baby attaches their mouth to your breast to nurse. A good latch is key because it ensures your baby is getting enough milk and prevents discomfort or pain for you. But if the latch isn't quite right, it can lead to sore nipples, frustration for both of you, and even challenges with milk supply. Let's start with positioning. Finding a comfortable position for both you and your baby is half the battle. The cradle hold is a classic choice, but there's also the football hold, side-lying, or even laid-back breastfeeding. Experiment with these until you find what works best. The goal is to make sure you're comfortable and your baby is fully supported. Next, let's talk about alignment. Your baby's body should be facing yours, belly to belly. Their head, shoulders, and hips should form a straight line. Imagine how hard it would be for you to drink water if your head was twisted to the side. Once you're positioned, bring your baby close and wait for them to open wide. And I mean wide. You can gently stroke their upper lip with your nipple to encourage this. When they do open wide, aim for their bottom lip to hit the outer edge of your areola first. This helps them take in more breast tissue, not just the nipple, which is crucial for a deep latch. Now, let's talk about signs of a good latch. You'll know you've got it when your baby's chin and nose are touching your breast. Their lips are flanged outward like a fish. You're hearing rhythmic sucking and swallowing sounds. And most importantly, it shouldn't hurt. Some tenderness is normal at first, but sharp or ongoing pain usually means the latch needs adjusting. If you notice your baby isn't latched deeply enough, don't hesitate to gently break the suction with your finger and try again. It's okay to take a few attempts. It's all part of the learning process for both of you. Here's a little tip. Skin-to-skin contact can work wonders. Holding your baby close with their skin against yours not only helps with bonding, but can also encourage their natural instincts to latch. Sometimes, though, latching issues can be caused by things like tongue tie or a lip tie. These are conditions where the tissue under the tongue or lip is tighter than usual, which can make latching more difficult. If you suspect this might be the case, consult a lactation consultant or pediatrician. And speaking of lactation consultants, they're incredible resources. If you're feeling stuck or frustrated, reaching out for professional help can make a world of difference. They can observe a feeding session, suggest adjustments, and give you tailored advice. Lastly, give yourself grace. Breastfeeding is a journey, and every baby is different. Some latch easily, while others need a little extra practice. What matters most is that you're trying, and that you're meeting your baby's needs, whether that's through breastfeeding, pumping, or formula. If this video has been helpful, please give it a like and share it with another parent who might be navigating this stage. Don't forget to subscribe for more tips, advice, and encouragement. Remember, you're doing an amazing job.